Hey Carl, I heard about your dad passing away from a heart attack. I'm so sorry to hear that.
Thanks. The doctor said that he had coronary artery disease, which led to his heart attack.
What are some of the risk factors for coronary artery disease?
Well, the doctor told me that I'm at a higher risk of getting coronary artery disease due to my age, gender, family history, and of course, my smoking habits.
I've also heard that high stress can contribute to coronary artery disease. But what actually is coronary artery disease?
Coronary artery disease is a mismatched disease in which the major arteries supplying blood and oxygen to the heart tissue becomes damaged or blocked. This affects the blood flow to the heart tissue, which interrupts homeostasis. This homeostatic imbalance is caused by the heart being unable to receive nutrients, have waste removed, and receive oxygenated and deoxygenated blood. We are now going to discuss the normal physiology of the circulatory system. The two main arteries on the outside of the heart are the left and right coronary arteries.
Arteries generally circulate oxygenated blood, whereas veins usually circulate deoxygenated blood.
Now we're going to talk about the three layers in arteries. Arteries are made of three layers: the tunica externa, tunica media, and tunica intima. The tunica intima is in contact with our blood flow and is made of simple squamous epithelium. The tunica media is made of thick elastic tissue and smooth muscle tissues, which allow for vasoconstriction and vasodilation, and this helps maintain homeostasis.
Coronary artery disease develops from damage or injury to the tunica intima of the artery. This damage can be caused by turbulent blood flow, hypertension, components of cigarette smoke, and viral or bacterial infections. The damage attracts low-density lipoproteins to the damaged site. As these lipoproteins begin to build up and penetrate the endothelial wall, the lipoproteins begin to undergo oxidation. This oxidation sends signals to the leukocytes of the body, which come to phagocytize the low-density lipoproteins. The phagocytation of these low-density lipoproteins causes a chemical reaction which creates what is known as a foam cell. This foam cell is also known as the fatty streak. Once the fatty streak is formed, smooth muscle cells grow and form an extracellular matrix. The matrix forms a large portion of the erythematous plaque. This plaque calcifies and hardens, which continues to grow in size over time and narrows the artery's lumen and restricts blood flow. Things that put you at higher risk for getting coronary artery disease are increased blood pressure, which causes damage to the vessels in the heart, obesity, smoking, living a high-stress lifestyle, eating a poor diet that is high in fats, gender, specifically being male, and your genetic makeup. There are three main symptoms of coronary artery disease. The first being shortness of breath. This shortness of breath is caused by the decreased ability of the heart to fill and empty, producing elevated pressures in the blood vessels around the lungs. This causes decreased oxygen flow to the tissues of the heart. Another commonly felt symptom of coronary artery disease is what's known as angina. In layman's terms, this is what's known as chest pain. This chest pain is felt because of the increased pressure exertion on the decreased diameter of the blood vessels surrounding the heart. This is felt as squeezing or tightness in the chest. The final symptom of coronary artery disease that we are going to discuss is what's known as myocardial infarction. This is what's commonly known as a heart attack. Myocardial infarction is caused by a complete blockage of the coronary arteries. This complete blockage prevents blood flow from getting to the tissues of the heart. This causes the tissues that the artery was supplying to die off and become necrotic. This necrosis causes permanent damage to the heart tissues.
Hey Carl!
Hey!
Wow, you're looking great!
Thanks! My dad's passing testing was a real wake-up call. I've changed my diet and lifestyle to combat this mismatched disease.
Oh, so your risk factors have greatly decreased, hey?
Yeah, I've done some research, and although I can't eliminate all of my risk factors, I'm making simple changes such as eating well, exercising, and just overall being healthy, which greatly decreased my chances of getting coronary artery disease.
Wow, Carl, good for you.
Awesome!